With us now is House Minority Leader Hakeem Jeffries, who met with President Trump and Republican congressional leaders late today. Leader, thank you so much for being with us. You walked out of that meeting just a couple hours ago. How much closer are you to averting a shutdown?
Well, we're under 30 hours until a government shutdown, and it's unfortunate if Republicans decide that they want to shut the government down because of their unwillingness to deal with the health care crisis that they themselves have created, the largest cut to Medicaid in American history. Hospitals and nursing homes and community-based health clinics closing as a result of what they've done with the one big ugly bill. The Republicans' refusal to extend the Affordable Care Act tax credits, which will impact working class Americans all across this country who are about to experience dramatically increased premiums, co-pays, and deductibles at a time when the cost of living in the United States of America is already too high. We are willing to find a bipartisan path forward and reach a spending agreement that keeps the government open, but that agreement has to meet the needs of the American people in terms of elevating their quality of life as opposed to continuing Republican efforts to gut their health care.
You use the words has to. In this deal, do you have to extend Obamacare subsidies or bust? How non-negotiable is an extension of Obamacare subsidies for you?
This is not simply a negotiating tactic. This relates to the well-being and the health of the American people. More than 20 million Americans are on the verge of experiencing increased health care costs because of the Republican refusal to address the Affordable Care Act tax credits that benefit working class Americans. The overwhelming majority of the people who rely upon these tax credits make less than $63,000 a year. These are people in rural America, urban America, small town America, the heartland of America, and black and brown communities all throughout America who are already being victimized by the Republican all-out assault on their health care and being victimized by the fact that these tariffs are actually increasing costs on the average American family by thousands of dollars a year. We are ready to find a bipartisan agreement, but that bipartisan agreement needs to address the health care crisis that exists in the United States of America and the cost of living crisis that exists in the United States of America.
Leader Jeffries,
right now.
But what specifically could they offer you on Obamacare subsidies in the next 36 hours that would get you to agree to a deal?
In the conversation, we've made clear that the Republicans have a position, and that position is that they're uninterested in addressing the health care needs of the American people, and that our position with respect to the Affordable Care Act tax credits is a permanent extension. And we're waiting to hear back from Republicans after that meeting as to whether they are willing to actually sit down over the next 30 hours or so and find a bipartisan path forward. House Republicans are on vacation right now. House Democrats are here, ready to do the work of the American people. Senate Democrats and even Senate Republicans are here in the Capitol. And it appears, at least to me, that a decision has been made by House Republican leaders, perhaps blessed by the administration, to shut the government down. Why did they cancel votes? Why are they on vacation spread out across the country and the world when we're on the brink of a government shutdown?
So Leader Schumer told reporters today that it seemed like the president was unaware of the ramifications of some of the expiring Obamacare subsidies, something that the vice president and speaker refuted. But what did you see in here from President Trump on that issue?
It was a frank, sharp, and candid discussion about our views related to the health care crisis that Republicans have created. There was a difference of opinion as it relates to the implications of that crisis, but we were very clear as it relates to our defense of Medicaid and Medicare and hospitals and nursing homes and community-based health clinics and the Affordable Care Act and medical research and the fact that in this Republican appropriations bill in the House, they are going after the National Institute of Health and going after the Centers for Disease Control in ways that will hurt the average American family.
What I was asking is that Senator Schumer suggested there were things that the president was unaware of. Senator Vance actually said that there were certain times where you or Senator Schumer would say things and President Trump would agree with them. What were they? What were those things?
Listen, we had a conversation about the importance of health care generally to the American people. There was a difference of opinion in terms of the implications as it relates to the one big ugly bill. We were very firm in our resolve to address the issues that related to the health, the safety, and the economic well-being of the American people.
We have a source who says that you told some Democrats after this meeting that President Trump actually did a fair amount of listening when you were meeting. What was he listening on? How much more of a receptive ear do you think he might have than your Republican counterparts in Congress?
I'm thankful that the meeting took place. It's unfortunate that Republicans in the House and the Senate have effectively tried to steamroll Democrats up until this point, and we've made clear we're not going to back down, particularly as it relates to defending the health care of the American people. So the four legislative leaders were brought together. President Trump called the meeting, and we were able to actually finally have a discussion about our priorities in defense of the American people, about the Republican position, and about the need to find common ground. So there was a lot of listening and a back and forth discussion throughout that meeting. Sharp disagreements, but sharp disagreements in the context of both sides being able to fully articulate our positions.
What about a 7 to 10 day short-term funding bill so that you can keep talking about this? It would keep the government open for the next 7 to 10 days, and maybe you could keep talking more about Obamacare subsidies and the like.
We are a no when it comes to kicking the can down the road. This issue needs to be dealt with immediately.
What about other people in the room? What was Vice President Vance like to negotiate with?
Well, Vice President Vance joined the meeting about halfway through and asked questions relative to the Democratic position, and we articulated our position as to why we believe there's an urgency in terms of addressing the Affordable Care Act tax credit issue. It's because more than 20 million Americans are on the brink of experiencing a dramatic increase in their health care costs. We're talking thousands and thousands of dollars more per year, all across the country. And in an environment where America is already too expensive, that's unacceptable. And we're fighting to bring down the high cost of living, which Republicans promised to do on day one. That hasn't happened. Costs aren't going down, they're going up.
The notices for people on the Obamacare subsidies go out very shortly. They don't actually expire till the end of the year, but I do understand what you are saying in terms of these negotiations. I said 36 hours. There aren't even 36 hours left. 24 hours, actually 28 hours until the government shuts down. House Minority Leader Hakeem Jeffries, we do appreciate your time tonight. It could be a busy day and a little bit for you. Appreciate it.
Thank you.